So when we look at the ideals for a jawline or lower face or neck, there are some characteristics that we all want. We want a sleek, tight jawline where we don't have bulges or pudge or fat. And then we want a long sweeping neck, and that includes a smooth, sort of wrinkle-free neck that looks its most rejuvenated and most youthful. It extends to the lower face too when we think about the jawline. You know, we like to make sure that the cheek area is well defined, the lower cheek, and that it's well separated from the chin. When that line starts to be blurred is when things start to look less ideal. To some extent, what's sagging down here is a result of what has been lost up here. So I often fill the face and fill the cheeks to create a bit of a lift here. Now that's one way of addressing it, and that's very helpful for a lot of patients. But I'm always careful not to over volumize the top of the face in order to create lift in the bottom of the face. It still has to remain natural. So down here, sometimes I put filler right in this crease here, and that helps camouflage the transition from the jowly area over to the under the lip area, and it really sort of smooths things out. So that's how we use fillers in two different ways to address the lower face. So the other thing that I find really helpful in addressing sort of aging in the lower face is Botox or a similar product like Dysport or Xeomin. If injected in the right muscles, then it creates a sort of a lift of the lower face. Now there are muscles down here that sort of pull down. That includes the neck muscles that as we talk or as we animate, they pull down and eventually they cause a downturning of the corners of the mouth and a sort of increase in the jowl. So when we use Botox or Dysport or Xeomin, it really gives a little bit of elevation of the corners of the mouth and the lower face. So if someone literally just has an excess amount of fat under their chin or along their jawline, it's a fairly simple fix. We address the fat, and there are a few really good treatment options. My favorite today is probably cool sculpting because it allows the fat to be addressed directly, and it gives people a really great, fantastic result. Now, if you need some tightening, I really like all therapy for the area because it just sort of tightens up that jawline and gets rid of the excess fat as well. So cool sculpting is a device that actually freezes fat cells. It comes with an applicator that's attached to the area that we're treating, and it freezes the fat while protecting the skin that overlies it. Fat cells are uniquely sensitive to cold, so they die and we get rid of them and flush them away, even while other skin tissues are left intact and safe. I really recommend OL therapy, which is ultrasound energy that stimulates tightening and lifting of the skin. Some people call it sort of the non-surgical option to a facelift. And while it's not exactly a facelift, you're using the same principles of sort of tucking up the skin, which is what we're all doing in the mirror when we have any amount of sagging or wrinkling. We're doing this sort of thing. And that's what it does, the lifting and the tightening of the skin. It really helps with jowls. It helps with sort of wrinkly necks or sagging under the neck or chin. So I had an older patient who came in and she said that her lower face was bothering her. And she said the reason is that she had a granddaughter who was about 5 years old who drew a picture of her. And in the picture, she had 2 round balls right here. And she asked her, "What are those things that you drew down there, Nana?" And she said, "Oh, those are your cheekbones." And so I forever think of that story when I think about how we age and our cheekbones move from up here to down here. Obviously not literally, but that's how the volume tends to migrate as we age. When it comes to maintaining the health and results of the lower face treatments, then I recommend a couple of different skin products. Always sunscreen and sun protection, which helps mitigate the effects of UV radiation on the lower face skin and all the skin. And then products that have peptides and or growth factors, which help replenish collagen, elastic tissues, and what I call the cushion that makes our skin look hydrated and volumized.